Meghan Moyer.
Chair Knowles, Vice Chair Goodwin, Vice Chair Nelson, members of the committee. For the record, my name is Meghan Moyer. I'm the Public Policy Director at Disability Rights Oregon, but today I am a patient, and I have used patient assistance programs. Although I am fortunate to not have a life-threatening condition, I do have a condition called urticaria, which is a fancy word for chronic hives. And it is unfortunately very uncomfortable, and I was not responsive to the normal courses of treatment. In fact, I tried 4 different treatments before my allergist finally said that I needed to try a monthly injectable called Xolair. It was new to the market, and it was specifically for asthma and urticaria. I finally agreed, having absolutely no idea that this was an incredibly expensive treatment. I didn't think that treating hives could cost $3,000 a month. I went to my allergist where I received shots, and for 3 months, assumed that when I paid Kaiser to go in the door, that was my copay, but unfortunately, I received a bill for the 3 months injection that was $998 per injection, was my 20% out-of-pocket cost. I was devastated. At that point, I was a single parent and had absolutely no way of covering this. I then started to spread out my injections longer than I was supposed to, which I didn't realize would make my condition, my flare-up, last longer. I didn't know that, and really waited until it was unbearable. Finally, a nurse at the allergy clinic told me that the company that made my drug had a patient assistance program. I called them, and they helped me pay for my portion of out-of-pocket, letting me finally get that flare-up under control. I now have a health plan that has a copay accumulator. I dread every day that I'm going to get another flare-up, and I will not be able to afford to pay for it. My fear is pretty severe discomfort, but I won't lose my life. There are other people who have to make these type of decisions who are not looking to treat hives, but they're treating cancer, hemophilia, HIV, MS, and many other conditions where unfortunately the only effective treatments for them happen to be extremely expensive. Disability Rights Oregon understands that our healthcare system is highly flawed. We are not saying that insurance companies or pharmaceuticals are to blame or are blameless. We are simply trying to center patients in how we navigate moving forward. And this issue is about patients. People pay for health insurance feeling like that means they are going to be able to receive the health care that they need. And unfortunately, if they happen to have a condition that needs a very expensive treatment that does not have a generic option, they might also be paying thousands of dollars out of pocket. Thank you.
Thank you.